I wanted to do nursing because I was always interested in caring and helping people, and I always wanted to work with people.
It's getting to see that person walk out the hospital door back to the road to recovery is what it's all about.
Nursing is just such a diverse job. Every day is different. You're meeting new people all the time. You'll have different challenges every day. You're on the go, you're moving.
For me, Waterford was always an attraction because as it's a city, but it's quite small.
The student life here is really good. It is like a community here. A lot of the students live together on different campuses and different accommodations.
Accommodation is all very close by and it's cheap as well. It's not an expensive area to live in or go out in.
It's good crack around the college, there's a good atmosphere.
Waterford City is a great place to live and there's so much to do.
I find it really good doing nursing in WIT because the class sizes are smaller, there's better relationships between lecturers, you get to know people quicker.
You will make your best friends in your own groups.
What the smaller colleges makes it more personal. When I come in the morning, I can say hello to all my lecturers.
They know your name, you know theirs.
Everyone is so approachable here in WIT, there's great support systems for students.
It's very much an open door policy with the lecturers here. If there's anything you need to know, it's no problem to stop them in a corridor or go up to their office.
People care that you do well.
The nursing programme is taught within the health sciences building.
It's on the main Cork Road campus.
So everything is all compact, it's all together, you don't have to travel for your classes, they're all in the one place.
You're in the one setting, you're surrounded by nurses.
And then in the clinical skills labs then we get an opportunity to practice in the mock wards.
And you would practice taking blood pressures and temperatures and so on.
So that's fun as well, and it's a good way to learn, it's interactive, it's hands-on, it's not just sitting in a lecture.
It's all about the participation, we all have a chance to take part in that skill.
The fact that you spend so much time in college doing it, you do feel confident by the time you're out in the wards that you're able to do all the tasks you're meant to do.
The best part of the nursing programme, every year you get to go out on clinical placement, which is organised for you.
WIT is linked to other hospitals within the southeast where we can also practice our clinical training throughout the 4 years.
When we're out in practice, we learn by doing, so by observing other nurses, following what they're doing, they help us, and then we learn it kind of hands-on the job.
There's a huge amount of support when you're on clinical placement. On the ward, you're given a preceptor, so that will be a staff nurse on the ward who basically is going to be your kind of go-to person for the amount of weeks that you're on the ward. You'll very much look forward to the clinical placement. It's one of the best parts of the course is actually getting to be a nurse.
There are 3 different nursing programmes here in WIT: general nursing, psychiatric nursing and intellectual disability nursing. Intellectual disability nursing is nursing people who have intellectual disabilities and supporting them with just their basic activities of daily living. So we could be working with children in areas to do with children, special schools, right up to adolescents, adults and older adults. So you're working with doctors, physiotherapists, different individuals, and then also communicating with their families. And we get to know our clients better. They're with us for years. They grow and develop through our help and through our care. So you're their advocate, you're their educator, you're their facilitator, and it's kind of all about working towards what they want, their wishes and dreams, and how you can help them achieve that then.
I personally chose psychiatric nursing for it's more focused on the mind. Like 1 in 4 people in Ireland will suffer a mental health problem. So range of different mental health problems you'll come across, from depression to schizophrenic illnesses to bipolar disorders. And then there's many different areas you can work in. There's the forensic services, in addiction services, child and adolescent mental health services, and working out in the community with people in their homes. It's very much about helping them along their road and so that they can go back to living a normal life. I think that's very gratifying and rewarding to, see people at their worst and then maybe being able to bring them back to what they were before they were at their worst.
A general nurse is a nurse that you see in the medical ward, the surgical ward. They work in A&E, they work in theatre, and they're also public health nurses. They work in community, they work in a doctor's surgery. When you finish the general nursing programme, you can go on to do children's nursing and midwifery. Patients I could be looking after are elderly patients, I could have young children, I could have patients of my own age. It's all about being the advocate for the patient, ensuring that their voice is heard.
I was recommended by my school and my careers teacher that for WIT, for nursing in particular, that it was the place to go because of the facilities, small class sizes, that the nurses that do graduate from WIT have a good reputation, that they're very well trained, theory-wise, also practical-wise. So for me, it was a no-brainer that that's what I wanted to do, and the facilities were there.
At the end of my 4 years in nursing, I'll have an honours degree in science and I'll also be a registered nurse. With the skills that you have from WIT, you can travel all over the world, as Irish nurses are internationally recognised.
For anyone who wants to do a job that's different and a job that kind of, at the end of the day, you know you've done good, you're helping people and someone has had a better day just because you were there.